Hello everyone, my name is Akriti Pandit. I am currently a MPH student at Boston University and I am delighted to be considered a finalist for the Program Management Consultant position at Treatment for All. I would of course like to thank you for finding the time to view this video, and in recognition of your time I wanted to provide you with an outline of how I plan on utilizing my next several minutes with you. First, I will provide you with a current picture and a brief analysis of the situation at the clinic. After that, I will dive into my approach as a consultant to explore this issue. I will then walk you through potential deliverables and strategies through which the clinic can implement said recommendations. Then I will briefly touch on challenges that I may face in conducting this assignment. And finally, I shall introduce myself, my background, and my other valuable tidbits that I can bring to TFA as your consultant. Let's start with some numbers. The Total Life Clinic, which serves and provides care for patients living with HIV, has a total patient panel of just over 18,000 individuals. This is not including the non-medical patients of over 129,000 patients. This highlights the expansive reach that this clinic has within the community and in serving vulnerable populations. However, within this number, we know that the patients are having to wait more than 3 hours for their medical visits and 2 hours just to receive medications from their pharmacy. One can imagine that this is greatly affecting patient experience for the same patients that the clinic is hoping to reach and care for. Now, clearly the numbers are telling us that there is a problem, and so I wanted to start out by walking you through a patient's experience in the clinic. Let's start with the patient. Let's name her Tally. Tuesday, 8:30 a.m., Tally arrives to the clinic. She is here for her medical visit and is here to see the doctor to receive her ART medication. Now, the clinic opens at 7:30, and she comes in just an hour after it opens. In fact, 86% of patients come in prior to 9:30 a.m., and this may be due to various reasons. Perhaps patients come in earlier knowing that the wait time is going to be long, or perhaps we should look into barriers to access, such as transportation. We can also look at the scheduling system. Was Tally only given a day for her appointment but not the time? These are several implications that stand out, but they do not even begin to consider other personal patient barriers. It is now 9:10 a.m. and Tally has waited just about 40 minutes to give her patient card to registration. This is 40 minutes spent waiting to get acknowledged by a staff member at the clinic. At 9:10, after giving her blue card, Tally waits to receive her file from the registration staff. And then at 10:08 a.m., Tally receives her file from the staff. It takes the staff 58 minutes to do this. This has several implications as well regarding the information management systems specifically, as well as staff capacity. After receiving her file, Tally is finally seen by a medical staff. At 10:10, she is sent to the nurse's station to get her vitals taken, and then she enters another station to get those vital signs entered into the system itself. Seemingly there are no issues here because the process takes less than 10 minutes. However, it does make me think about what the need for the two separate lines are. Can we cut this time to 5 minutes by making this process more streamlined? Then at 11:37 a.m., Tally finally meets her doctor. By now, she has waited about 3 hours. And then at 11:50 a.m., Tally is done being evaluated by the doctor. She spends 13 minutes with them. Then at 12:59 p.m., she finally gets her medication from the pharmacy. If the doctor is spending 13 minutes per patient on average, is the reason for Tally having to wait over an hour after getting triage due to the sheer number or the volume of patients ahead of her, or is it because there aren't enough doctors working? The wait time to get seen by a doctor after being triaged is a major bottleneck area that needs to be streamlined. In order to improve the operation efficiency for this case, we can consider solutions around staff modeling, such as task shifting as well. By the time Tally schedules her next appointment, she has spent a total of 4.5 hours in the clinic. Consider this. If the reason Tally went to the clinic was to only get a prescription from her doctor for her ART medication, was a 4.5-hour wait really necessary? Now, so far, I've identified several areas of concerns at the clinic, despite how little information was given. But for the actual task itself, there needs to be data collection and analysis on several levels to get an in-depth understanding of core issues affecting the clinic. Now, as a consultant, it is very important to consider point of views from multiple sides. This includes point of views from patients like Tally, lower level staff, leadership team, and even neighboring facilities. Therefore, my initial assessment will be to gather data, specifically qualitative data from all key stakeholders and informants, as well as quantitative data, whatever the clinic is able to provide. Then comes the analysis phase. For this phase, I would use the data collected to identify internal strengths, weaknesses of the clinic, and external threats and opportunities from the data gathered. Next, I would use process maps to map out the clinic flow. This will help me identify steps where there are delays, problems, or bottlenecks, and identify resources. I can also identify steps in process that do not add value, such as delays or unnecessary work or expenses, and even breakdowns in communication. These are points where the improvement work can actually start. Another way to formulate recommendations is through researching best practices. Then based on my research, I will create recommendations to implement for both long-term and short-term. Engaging stakeholders is another crucial step to ensure effective implementation and achieve optimal outcomes. And after gathering input from all stakeholders, I would first consider rolling out a prototype based on the type of recommendation. This is especially true if the recommendation involves significant staff training, such as introduction of a new information management system. If we are introducing such a system, it would not be feasible for all staff members to be trained at once. In this case, I would most likely recommend the trainer approach. So considering different implementation concerns as well as approaches is also very important. Finally, it is always important to have a plan moving forward. An evaluation plan is necessary to ensure that there are actual improvements happening. Whereas in creating a sustainability plan, I would highly involve the clinic's leadership team to ensure availability of future funds, other resources, and to ensure that all the members of the team, as well as the lower level staff, have the same vision aligned for the clinic's progress into the future. Then, based on my rough analysis and approach, I foresee several deliverables that tackle several areas that I talked about in the walkthrough itself. The first deliverable would be a review and analysis of the current clinic workflow. Based on the analysis, I would want to tackle the scheduling system. There is a deeper reason for 86% of patients arriving before 9:30 a.m. every day. I would also want to implement an improved information management system. This has funding implications that may not be feasible financially, but if there are smaller ways to make this system more efficient, such as having another staff member or having a streamlined workflow, then this is an area that definitely needs to be addressed. Lastly, I think it is important to consider immediate and small changes that can lead to major improvements. There isn't always a need to reinvent the wheel. While there are big changes occurring, we can also consider if there are smaller changes that can be made to improve patient experience. Now that we've briefly talked about the deliverables, the ideas, and the recommendations, next comes the crucial step of implementation. There are several other strategies that can have a snowball effect in making optimal changes. One such example is communicating problem areas during the implementation phase by creating a feedback loop. between staff and leadership. This encourages all levels of staff to be highly involved and share a common vision, which ultimately plays a role in sustaining changes for longer periods of time. As a consultant, it is important to think about both implementation strategies and challenges that come with it. And while implementation challenges are in the league of their own, especially in lower resource settings, there are often other challenges that can go overlooked. Let's first start with the most obvious challenge, which is human resource constraint. It is often the case that clinics such as Total Life Clinic are understaffed, undertrained, and overworked. Additional responsibilities and changes may add to staff burnout. Plus, the lack of organizational infrastructure as well as funds to properly introduce the changes can lead to unfruitful outcomes. Other challenges, as mentioned, are change management and leadership support, as well as policy constraints, as in are recommendations in line with clinic as well as governmental policies. There is always a concern of lack of oversight or low motivation to follow through as a result of differences in priorities. And a deeper issue that I wanted to touch on is cultural difference. As a consultant from Boston, I will be engaging with staff and patient at the Total Life Clinic. However, their culture is vastly different from what I have been raised with. And personally, I see this as a challenge because I'm not fully familiar with their culture as well as the organizational culture. While I will do my best to remain humble in that regard, it will be important for me to be fully aware of every suggestion I make or disregard. And with this, we are nearing the end of the video. I do want to give you a very brief introduction of myself and the expertise I can bring to TFA. Hello everyone. A little bit about my consulting experience. As a graduate student, I have done public health consulting for two different organizations, Boston Medical Center and Nurture Africa, which is based in Uganda. At Boston Medical Center, I was tasked with reducing no-show rates at the family medicine clinic, so I can certainly bring the knowledge and perspective I gained through my experience for a very similar and very interrelated challenge. And while Boston Medical Center is largely well resourced and well funded, so the context will be different, I also bring the point of view of working as a student consultant for a low resourced health center in Uganda. Working with them has given me valuable and insightful lessons on what it means to be a consultant and work with limited resources and come up with creative solutions. And as TFA's consultant, it will be crucial in my approach to put issues into context and provide evidence-based and provide sustainable solutions to promote health and improve healthcare delivery for all, and especially for those living in low-resourced areas such as patients like Tali. And with that, I want to thank you for your time in viewing this video. I look forward to hearing from you. Please do not hesitate to reach out to me by connecting to me via LinkedIn or through my email. Thank you, and I hope you have a nice rest of the day or evening.